Good morning, ladies and gentlemen. Once again, welcome to our Exhibitor Technical Presentation webinar for today. Today we have 3 speakers. And before we begin, I just wanted to make a quick housekeeping announcement. Our speakers will be taking questions. So if you have any questions for them, please feel free to submit it via the Q&A button at the bottom of your screen. With that, I shall hand over to our first speaker for today, Phan Tuan. Phan Tuan, over to you, please.
Thank you for your introduction. So good morning, ladies and gentlemen. Welcome to my webinar today. So my name is Nguyễn Văn Thuận from the R&D department of Usm Healthcare Medical Devices Factory Trust Stock Company. Our managing director, Ms. Võ Xuân Bội Lâm, was supposed to be the speaker at this section, but due to her sickness, she has supported me to give the presentation on her behalf. So today I'm going to talk a bit about our company and share the insights into one of the main products that we have been developing recently. Okay, so my topic is the great safety and efficacy of a new drug Eluting stent manufactured in a developing country at minimal cost, the Vstent made in Vietnam. First of all, I would like to have a brief introduction about Usm Healthcare. So our company was established in 2012 with its factory construction completed in 2015. We are based in Saigon High-Tech Park, Ho Chi Minh City in the south of Vietnam. Our facilities are well organized and highly equipped with the machinery and technology mainly transferred from US and European countries. We have a young and enthusiastic staff. There are available clean rooms class 100,000, 10,000, and a special clean working bench capable of producing a wide range of medical devices. We fully comply with the quality management system required as a medical devices manufacturer, such as ISO 9001, ISO 13485, and GMP FDA. Our product portfolio includes cardiovascular devices like stents, balloon catheters, accessories, medical disposables such as IV catheters, breathing circuits and filters, wound and IV dressing, infusion set. Especially during the COVID-19 pandemic, we focus on making the face mask, face shields, protective clothing, straps and gowns to supply the urgent market need. We have achieved the CE certification for some devices like stent, balloon catheter, and IV catheter. We have exported some of them to the neighboring countries in Asia. So in the next slides, I would like to share with you the insights into our main product, the Vstent, sirolimus eluting coronary stent system, fully made in Vietnam. What is drug eluting stent? Maybe you already know that coronary artery disease is the third leading cause of mortality worldwide, and there are several treatment options available for this disease, in which the use of drug eluting stent during a minimally invasive technique called percutaneous coronary intervention is the most common one, with clinically safety and efficacy. So technically, drug eluting stent is a small mesh tube coated with a drug placed into a narrowed diseased artery to keep it open, and at the same time release the drug to inhibit the proliferation of the smooth muscle cells, thus reducing the rate of restenosis after implantation. And our Vstent is in that type of DES. It is designed and indicated for treating coronary artery disease with the reference lumen diameter from 2 to 4.5 millimeter and lesion length less than 44 millimeter. Here are some technical features of our product. There are 4 key elements that contribute to the performance of Vstent: a dedicated platform made of cobalt chromium alloy, a rapid exchange delivery catheter, a proven sirolimus drug, and reliable bioabsorbable PLGA, PLLA polymers as drug carrier. Here is a summary of our product features. It has hybrid open and closed cell design with 65 micron struct thickness, an effective drug dose of 1.33 microgram per square millimeter, a single matrix of drug coating to release the drug within 90 days, a wider range of diameter from 2 to 4.5 millimeter and from 8 to 48 millimeter length. And the first and important part of the Stent of Vstent is the Stent platform with its unique design. You can see in the slide the 2D sketch of our Stent design. It has the closed cell at the proximal and distal region with the straight connector to increase the longitudinal strength and reduce the dog boning effect due to balloon inflation. The open cells with C crowns and U connectors in the middle part of the stent help minimizing vessel injury, allowing homogeneous arterial coverage, enhancing flexibility and conformability into tortuous vessel, as well as minimizing the foreshortening after stent expansion. The second part of Vstent is the rapid exchange delivery catheter with its semi-compliant balloon made from nylon PBAX material for optimized crimping and proper stent expansion. It is compatible for 5 French guiding catheter with a low crossing profile of approximately 1 millimeter for the 3 mm stent. The provision of hydrophilic coating on the distal part, the smooth proximal distal transition area, and the mirror polished stainless steel proximal hypotube offers the enhanced crossability and deliverability of the stent to the lesion site. Talking about the drug coating of our product, Vstent has a symmetric coating with only 1 layer of mixed biodegradable PLGA, PLLA polymers and sirolimus drug to provide a consistent, controlled, and 100% drug release within 90 days. It has an effective drug dose of 1.33 microgram per square meters on the stent surfaces with a maximum amount of 300 microgram for the largest stent size. These pictures show the high durability and flexibility of the coating layer at crimping and also after expansion. We have a broad product size with up to 108 references. The catheter working length is 140 centimeter. The nominal pressure is 7 bar, and the rated burst pressure is 14 to 16 bar, depending on the balloon or stent size. Okay, and in the next slide, I would like to give you the evidence of the safety and efficacy of our Vstent through a recent clinical trial. From June 2019 to end of 2021, a prospective non-randomized multi-center study involved 150 patients were conducted in Vietnam to evaluate the safety and efficacy of Vstent in patients with PCI indications. The principal investigators were Dr. Ho Thượng Dũng from Thống Nhất Hospital and Dr. Trung Quang Binh from University of Medicine and Pharmacy Hospital. The follow-up regimen were angiography follow-up at 6 months and clinical follow-up at 12 months. The primary endpoints were binary restenosis and late lumen loss at instant and inception at 6 months, angiography, and MACE at 12 months, in which MACE was defined as a composite of cardiac death, myocardial infarction, and target lesion revascularization. The following rates of our study were 95.3% angiographic follow-up at 6 months and 96% clinical follow-up at 12 months. You can see in the chart, 100% population of our study were Vietnamese people with presence of high risk of coronary artery disease, such as 74% hypertensive, 50% dyslipidemia, more than 30% former or current smoker, more than 20% diabetes, and more than 17% history of CAD. 80% of the population had acute coronary syndrome, and more than 95% of the lesions were classified into type B or type C, which were moderate to complex severity. The number of stents per patient were 1.4. The study reported 100% device success and 99.3% procedural success. The angiographic results at 6 months follow-up showed in-stent and in-segment late lumen loss approximately 0.08 and 0.07 millimeter respectively. And the in-stent and in-segment binary restenosis were 0.5 and 3.5% respectively. At 12 months clinical follow-up, the results reported that the MACE rate was 4.7%, including 0.7% cardiac death and 4% target lesion revascularization. There was no stent thrombosis reported in our study. In order to have a summary of how our stent clinical performance compared to the other, we have collected the clinical study result of some of the renowned drug-eluting stents in the market, as you can see in the table. These drug-eluting stents are made of cobalt chromium material with a silver structure incorporated with biodegradable or durable polymer. The number of patients in their study ranged from approximately 100 to 450, similar to our study population. And in the next slide, you will see the comparison chart between our Vstent and other devices. And our product performance have very similar and within the range of other device performance, from device success and procedural success to binary restenosis at 6 to 9 months angiographic follow-up with very low in-stent and in-segment restenosis. The favorable late lumen loss at in-stent and in-segment, and also the low rate of MACE at 12 months follow-up, less than 5%. So in conclusion, this prospective multi-center study of Vstent system demonstrated high procedural success and satisfactory up to 1 year follow-up safety and efficacy results, low rates of MACE, no stent thrombosis, low binary restenosis, and favorable in-stent, in-segment late lumen loss. Especially IVUS and OCT techniques were used to optimize the stenting procedure in this study. And our clinical results were successfully reported at the SCAI 2022 scientific sections in Atlanta, US this May. It had drew the attention from some VIPs in this field. It was also published in the Journal of the Society of Cardiovascular Angiography and Interventions this year. So summary, in the technical standpoint of view, Vstent is in the same category as other renowned drug-eluting stents in the market. As you can see in the table, we have a relatively thin structure only one coating layer. We are using sirolimus drug, a proven drug with a reliable bioabsorbable polymer. Here are the key points of our Vstent. Its innovative design offers optimal radial strength, near zero foreshortening, homogeneous arterial coverage, flexibility and conformability into tortuous vessel. It has a reliable coating with proven sirolimus drug and biodegradable polymers, providing favorable endothelial growth, high integrity, and durability. The recent clinical trial of Vstent demonstrated high safety and high efficacy up to 12 months follow-up. So Vstent, the newly developed mating stent system, demonstrates favorable outcomes with comparable safety and efficacy to other renowned TES. Vstent could be an affordable choice for interventional cardiology service in developing countries. So that is the end of my presentation. Thank you very much for your attention.
Thank you, Phan Tran. So to the audience, if you have questions, please feel free to submit them via the Q&A button at the bottom of the screen. So while you're doing that, let's move on to our second speaker for today. Over to Lean from TMD, please. Lean, over to you.
Thank you, Daphne. Hi, thank you for joining us today and offering us your time. I'm Lynette Choi from the Business Development team, and I'll be giving the introduction of TMD Lab today. Before we begin, I would like to provide you with an overview of the topics that will be discussed. Firstly, I will speak about the SMP, and then continue to the product and company introductions, and then to the business model. Probably some of you are familiar with shape memory polymer, but some are not. Shape memory polymer, shortened as SMP, is a polymer programmed to have a specific shape under certain condition and return to the original shape from a temporary shape under the given identical condition. And in our company's case, especially with medical device pipeline, the condition is the body temperature. If you look here, the spring shape is the original shape, and this linear shape is a temporary shape at room temperature. This linear shape recovers the spring shape at body temperature. I will show you a video for a better understanding here. This is a linear shape at room temperature. And when it's moved to the body temperature, it recovers to the spring shape. We made it a simple shape as a spring shape as an example, but imagine this can be applied to various shapes. TMD Lab's SMP is PCL, polycaprolactam based, and this polymer is known for biocompatibility. There are not many companies that have SMP technology, and even less with PCL-based SMP technology. We combine PCL with various types of polymers, such as silicon, PGMA, PLA, and PIC. The shape is restored at body temperature. The shape recovery time is adjustable from seconds to minutes, and we are building the material library to have a wide range of physical and chemical properties. Another strength of our SMP is that it suppresses the biofilm. Biofilm is a collection of bacteria, fungi, etc., microorganisms that adhere to a surface, and it causes chronic inflammation, delayed wound healing, and severe complications after the surgery. It is the nature and the character of our material that bacteria are less attached to the surface. Traditional silicone materials are prone to biofilm accumulation, which increases the risk of infection and future complications. However, our material is unique in the sense that it is resistant to biofilm growth. If you look here, compared to silicone, the biofilm depression effect is by 74%. EVA is the material often used in bioduct stents, and the biofilm suppression rate is 52%. Next, I'm going to be introducing our product pipeline. We have lacrimal duct stents, punctal plug here, glaucoma drainage device tube for eye products. We have rhinoplasty or breast implants for cosmetic fields. We have vascular wrapping support, bile duct stent, and microneedle as well. First is lacrimal duct stent. This device is inserted in the lacrimal canal when the canal is obstructed. The tube self-expands at body temperature with SMP function, which means it can be minimally invasive. Other benefits are that the material is stable, as PCL is FDA-approved material, and that the biofilm suppression is excellent. Also, the water drainage speed is 13 times faster than silicone stent. This device punctal plug is useful for those with dry eyes. With similar characteristic, it self-expands at body temperature after the insertion and anchors itself in the tear duct. We are making the tube inside this glaucoma device support. It reduces the intraocular pressure, which is a major concern in the field. This is biliary stent. Bile area is one of the places with most biofilms, and our material prevents from re-occlusion of bile duct, which means the patients do not have to do surgery repeatedly. Again, some benefits of TMD LAB materials are written here, such as decreased restenosis, long-term patency, reduced biofilm, and convenience for the doctors and the patients. For hemodialysis patients who have weight gain, they do AVF, which is arterial venous fistula surgery, to strengthen the vein. After connecting vein and the artery, covering the outer walls of the conjunction points can help prevent re-occlusion. The placement of the device directs cell growth outward and strengthens the vein. It provides structural support. Another benefit is that it removes the need for sutures, since it is automatically coated with SMP function. Okay, this page shows the results of the preclinical test. Clinical research has proven that TMD LAB vascular wrapping support effectively prevents abnormal swelling and narrowing, or the formation of the blood clots. This is rhinoplasty implants. Silicone and vortex are the materials currently used, and the fixation was the limitation. TMD LAB implant conforms to the individual's nose and anchors itself, which solves the current materials problem. Next is the breast implant. This is also similar. The patterned membrane is moldable and therefore possible to customize. This is microneedle. We can make it drug eluting system as well. As the microneedle changes the shape after the insertion, okay, here, it improves fixation by shape deformation. The speed of dissolution is possible to be controlled. The physical properties of the microneedle are superior to other companies as well. Next, I will give a brief company introduction. Our founder, Professor Hak-Jun Song, originally taught at Vanderbilt University in the States, moved to Korea to establish TMD LAB. Currently, he is a professor at Yonsei University College of Medicine in Korea. We recently finished a Series B investment, and the whole investment capital is $13 million. In 2010, Dr. Song started developing SMP technology in the States, and now it has been upgraded to 5th generation. TMD LAB is established in 2018 and began its commercialization. From 2020, we have expanded the medical device pipelines. Our headquarters are located in Seoul, South Korea. These are lab and some production facility pictures. Next slide is last page, which is the short version of our business model. After the introduction and the verification stage, we try to provide solutions to your needs. As you can see here, there are various examples of possible collaboration. We can provide the material or upgrade the material to R&D cooperation together, OEM, ODM, or licensing out of the technology itself. As a growing company, we are always looking to fulfill unmet needs and innovate the field. We are open to any suggestions from the public regarding our product and future endeavors. Thank you for listening to this introduction to our company. This was Lynette Choi from TMD Lab. If you have any questions, I'll be happy to answer them.
Thank you, Lynn. So if you have any questions for her, please feel free to submit it via the Q&A button at the bottom of the screen. So now, while you're doing that, let us move on to our third speaker for today, Jeffrey from KPLASS. Jeffrey, over to you, please.
Hi, everyone. Thank you very much for your time. All right, so let's start. All right, KPLASS Singapore, we are a local company. We are factory in China. All right, we are the only one with 5 infrared pictures, which you can see from the screen. Right, we are the world's first and only 5 infrared patches for knee, cough, and pain relief patch. What makes us different, I will explain to you later on. Just see a short video first.
Ben, how was your day?
My papa, he always greets us with a smile when we come home. He asks the same old questions every day without fail.
Have you eaten? I cook.
I ate already.
Oh, okay. I will just pack for your lunch tomorrow.
I don't need, I'm going out for lunch.
Sometimes, we forget how much he's gone through, trying to raise us single-handedly.
My papa, he's always thinking of how to fill our bellies and keep us fueled to face the world.
You want some curry?
Sometimes we forget to thank him for all his hard work.
Okay? I'm okay lah. Just a small matter.
My papa, he never asked for help.
Okay, come drink some water.
Not because he doesn't need any, but because he doesn't want to be a burden to us.
Slowly, slowly.
Guys, we need to talk.
Try this on.
What is this?
It's a cough patch. Very good for your cough.
Oh.
You really need to take care of yourself. And
Let us take care of you too.
come. Okay, now you take 2. You take 1. Okay, first one stick here. Here. Okay, another one here. Okay, one more.
Yeah.
Low. Okay now. Okay, one more here. Okay. Bye.
How is it?
Got feel better not?
Okay, Anna.
Papa.
I really feel better now.
Che. Aya, don't play this kind of trick lah.
Funny, you know.
Scare me.
KPLASS.
KPLASS.
So let me explain what is far infrared. Okay, basically fine infrared is a kind of technology, all right? It can penetrate into our body, which open our pores and improve blood circulation, all right? So what it means is infrared, you can see CT scan or those MRI, they use infrared, but our infrared is different from that. We're using the ray, the infrared ray, all right? Okay, our fine infrared can penetrate our skin layer 2 to 7 cm deep into our skin. Thus, it generate and repair tissue immediately. So this is what we call fine infrared. You open the pores and transfer medication into the affected area efficiently, right? So since our bodies has temporary heat, all right, with this fine infrared, we does not need any chili or capsicum powder or menthol to generate heat, all right? You're using this fine infrared to generate heat in the body itself to produce the heat. So the heat is being controlled by your body. So everyone have different body temperature. For example, let's say I'm 36.9, you're 37. The body increased by 3 to 5 degrees, that's all. So you will not have overburn or overheating. You just feel warm sensation. That's fine infrared. Right? So our brands and other brands, what's the difference? Let's say talk about other brands, you only penetrate onto the surface of the skin, only onto the surface. But for us, it penetrates deep into the skin layer, which can go to the bone as well. That's fine infrared. So magnetic powder we have in our patches as well. It can generate activate cell. That's normal for magnetic powder. But what we're talking about is fine infrared. Okay, what is this called about thermal absorption? That means we're using TCM technology and Western technology to penetrate these patches into our body, thus relieve of cough, pain, or knee pain. So this is very effective against oral medication. But when they take oral medication, it passes through our body or digestive system and to the part that require medication. So in a way that long-term process, it will harm those organs we don't need medication. So with these patches, it goes directly to the affected area. Right, cough relief patch. Right, just go through. There are different type of cough. Right, acute cough, subacute cough, or chronic cough. But for our patches, all right, we are targeting first two, acute cough and subacute cough. All right, for chronic cough, you need to see a doctor. All right, so why make us different? For oral, I mentioned earlier, oral medication, all right, you need to consume from mouth to digest system. We mix the whole body in the sense that toxic to the medication. Let's say for cough syrup. Cough syrup is supposed to target our lung area. All right, so with medication, you go through our digest, go stomach, go through a whole system, then go to your lung, maybe left 20% effectiveness is there. All right, so the side effect for cough syrup, you feel drowsiness, you feel tired, you cannot do work. All right. All right, so this is our new packaging. All right, so in the packaging, it tells where to place it. All right, we can relieve your cough, your phlegm, and sore throat for patches. Each patches, 1 pack, 3 patches or 6 patches. All right, you need to use 3 patches for 4 to 6 hours. Let's say now you have started to have slight itchy throat or cough. Place it immediately, you'll feel the effect immediately. This is how the patches look like. Okay. Okay, this is the 3 areas where you go to paste. 天图道. On the first diagram on the left, 天图. This paste is to open the airway and pushes our mucus or phlegm back to our lung. All right. So the second paste, 淡中. This paste is to clear and dissolve the phlegm or mucus in our lung. And the third paste and back is to improve our immune system. This is more on TCM application. All right. So every 4 to 6 hours, you continue using until you recover. So for normal cough, let's say start to have cough. For normal cough, you just need two pack will do. 2 pack. Basically, you buy 1 pack and another pack, your cough will recover. All right, next is our pain relief. Pain relief is the same thing. All right, the only difference is our pain relief, there's only 2 ingredients. All right, there is fine infrared and adhesive, that's all. There's no chili powder, there's no capsicum, there's no menthol. Why? Because you're using fine infrared to generate your own body heat where we can cover. And the point is we're using acupoint to paste onto our body. Let's say you have a stiff neck, your shoulder pain, your backache, you need to paste on 1 point. That's the back of your spine, the first spine. That's the shape of this. All right, you just need to paste onto this area, which it can cure or relieve your shoulder ache, backache, and neck ache. Just 1 area. Next is a knee pain relief is the same thing. The ingredient and the pain is the same thing. It's just that the shape of this knee is targeting the knee. Because a lot of people have knee pain. When O or wear and tear, we have the knee pain. So this is targeting the area. This is the shape of the knee. So use the patch for 6 to 8 hours. Your pain will get better. All right. So this is how you use it. The same thing. So our cough relief patch. All right. Because of far infrared, we don't recommend people with VAD or medical support for the heart. All right. Pregnant women or breastfeeding, we don't recommend because of far infrared. All right. During application, try to avoid smoking, alcohol, spicy food. Why? Because with far infrared, place it on your body, all your body pores will open up. So we try to avoid all these smoking things. All right. So let's say if you feel any itchiness or redness, which is unlikely, please remove patch immediately. All right. For cough relief patch, 2 years and above we can use. And from pain and knee, everyone can use. All right, as I mentioned again, all right, for our pain relief patch, there's no agitating ingredient like chili, capsicum, or menthol. We don't have. It's just far infrared. Used to generate your own heat. All right, this is just our commercial.
KPLASS, catch your cough. KPLASS,
Catch a cough. KPLASS, catch a cough. KPLASS, catch a cough.
Can't find an effective patch for body aches? Try KPLASS, ergonomically designed with far infrared heating and deep penetration that improves blood circulation for pain relief. KPLASS, pain patch for knee, neck and aches around shoulder. KPLASS, patch and relief.
All right, that's all for my presentation. Thank you very much.
Thank you, Jeffrey. So if you have any questions for any of our speakers, feel free to submit the questions via the Q&A button at the bottom of your screen. We have also shared the exhibitors' booth numbers in the chat function. So these exhibitors will be at Medical Fair Asia 2022, which will take place from 31st August to 2nd September at the Marina Bay Sands Exhibition Center. So feel free to look them up at the exhibition itself. So let me just take a look. It looks like we have no questions for today. So this session is being recorded and will be placed for on-demand viewing in our digital edition integrated virtual system that will go live to visitors from 1st of August. So if you have not registered, let me share my screen and there you are. So if you have not registered for the exhibition, please scan this QR code and it will bring you to our registration page where you can submit your registration. It is free to visit the exhibition. All 3 exhibitors today, USM, TMD, and KPLASS will be at the show and more. So we look forward to seeing you there. We have more webinars coming up in the weeks ahead as well. The next one will be next Wednesday, 3rd of August. So do join us. Until then, we look forward to seeing you at the exhibition. Thank you and goodbye.